Welcome to Care of Patients with Malnutrition or Obesity Lesson Part 1. Food energy is used to maintain body temperature, respirations, cardiac output, muscle function, protein synthesis, and the storage and metabolism of food sources. Proper nutrition plays a major role in promoting and maintaining health. After this lesson, you will be able to collaborate with members of the healthcare team when providing care for patients with malnutrition or obesity. Perform a nutrition screening for all patients to determine if they are high risk for nutritional health problems. Interpret findings of a nutrition screening and assessment. Identify the key recommendations from the Dietary Guidelines for Americans 2010 document. Calculate body mass index, also known as BMI, and interpret the findings. Identify the role of nutritional supplements in restoring or maintaining nutrition. And explain the medical complications that are associated with malnutrition or obesity. Carbohydrates, protein, and fat are nutrients in food that supply the body with energy. Energy balance refers to the relationship between energy used and energy stored. The role of nutrition in disease has been a subject of interest for many years. The current focus is on health promotion and the prevention of disease by healthy eating and exercise. In the United States, the dietary guidelines are also referred to as recommendations or revised by the U.S. Department of Agriculture, also known as the USDA, and the U.S. Department of Health and Human Services, also known as DHHS, and this is done about every 5 years. The last recommendations were designed in 2010. These recommendations are to balance the food you eat with your physical activity, to include plenty of grains, vegetables, and fruits, low saturated fat and cholesterol, to moderate sodium intake, to moderate your sugar intake, and if a person drinks alcohol, do it in moderation also. They also replaced the traditional food pyramid with a My Plate recommendation. The plate indicates a simplified graphic approach. There is no exercise in this graphic. Meat and beans change to a more generic protein category. Milk becomes dairy, and elimination of serving size in exchange for proportion compared to other items on the plate. The new image provides an easy guideline for healthy nutrition and eliminates the unwanted food items. This image reminds people about the good foods to increase and the foods that should be reduced in the daily diet. Culturally, people may choose foods based upon their own preferences that are related to either beliefs or choices, ethnicity, or race. One example would be in congruence with the yin and yang. Yang stands for hot foods for cold and illness, and yin for cold foods for hot illness. Health teaching about nutrition should incorporate any cultural preferences, but do not assume that a patient's ethnic background dictates that he or she will only eat foods that are associated with their primary ethnicity. Here is an image depicting a few examples of ethnic food pyramids. A patient may also experience food allergies or intolerance to certain food products. An example of a common intolerance is someone who is lactose intolerant. It affects about 80% of African Americans, 90 to 100% of Asian Americans, 80 to 100% of American Indians, and 50% of Mexican Americans, and 6 to 25% of Caucasian Americans. It also affects babies that are born prematurely because lactase levels do not increase until about the 3rd trimester. Patients should avoid any foods that they have an allergy or an intolerance to. As we said, one of the most commonly discussed intolerances is lactose. Lactose is a major sugar found in milk. This can be problematic considering dairy is a dietary recommendation. In lactose intolerance, the patient has a shortage of enzyme lactase that is produced by the cells that line the small intestine. Lactase breaks down the milk sugar into glucose and galactose, which are then absorbed into the bloodstream. Some of the clinical manifestations are mild to severe. These include nausea, cramps, bloating, gas, and/or diarrhea. Treatment for lactose intolerant includes over-the-counter lactase enzyme, lactose-reduced milk, or each other high-calcium foods that have no lactose content. Some of these foods are soy milk, sardines with edible bones, salmon, canned with edible bones, raw broccoli, one medium orange, pinto beans, canned tuna, or lettuce greens. The link at the bottom of this page provides you a website that gives you examples of lactose-free foods. The nutritional assessment will include nutritional history, food and fluid intake, laboratory data, food and drug interactions, health history and physical assessment, an anthropometric measurement, which is a non-invasive method of evaluating nutritional status. It is a measurement of height and weight and an assessment of body fat. And it will also include the psychosocial assessment. Nutritional status reflects the balance between nutrient requirements and intake. Common factors that affect these requirements include age, gender, disease, infection, and psychological stress. Nutrient intake is influenced by eating behavior, economic factors, emotional stability, disease, drug therapy, and cultural factors. The initial nutritional screening includes inspection, measured height and weight history, usual eating habits, the ability to chew and swallow, and any recent changes in appetite or food intake. Examples of these questions can help identify the patients at risk for nutritional problems and are part of the history and physical assessment. Chart 63-1, page 1337 of your textbook provides examples of questions that can be used in nutritional screening and covers the areas of just general, GI, cardio, GU, respiratory, integumentary, and extremities. A mini nutritional assessment is often used. An example is provided in your textbook on page 1338. Changes in body weight can be expressed by three different formulas. One is weight as a percentage of ideal body weight. Another is current weight as a percentage of usual body weight, and then change in weight. The formulas are provided here for you. An unintentional weight loss of 10% over a 6-month period at any time significantly affects nutritional status and should be evaluated. We also have the body mass index, also known as BMI. It is a measure of nutritional status that does not depend on a frame size and is calculated by this formula presented here. This is the end of part 1 of Care of Patients with Malnutrition or Obesity lesson. If you have any questions related to the content of this lesson, contact the instructor.